day, everyone, especially to those who are eager to learn. Welcome back to our learning session. By the way, I am Teacher John and we will talk about how to evaluate and control hazard and risk. Come on, let us start. First, let us be familiar with the Occupational Safety and Health Center or OSHC. What is it all about? What is the purpose or mandate of Occupational Safety and Health Center? So the Occupational Safety and Health Center or OSHS is envisioned as the national authority for research and training on matters about safety and health at work. So the center provides expertise and intervention to improve workplace conditions in the Philippines. So what is the mandate of Occupational Safety and Health Center? So it is to protect the Filipino workers against accidents, illness, and to promote workers' welfare through effective programs that enhance productivity, well-being, and to afford social protection to its client. Now, in the healthcare workplace, evaluating hazard and risk is the process of determining the level of risk created by the hazard, injury, or illness occurring. So once hazard is recognized, then you can proceed with the risk assessment, which is focusing on the risks that matter. In evaluating and controlling hazard and risk, we have 5 major categories of control measures. By the way, what is a control measures? So control measures are actions or activities that are taken to prevent, eliminate, or reduce the occurrence of a hazard that you have identified. Number 1 is eliminating. Eliminating a hazard means completely removing the hazard, or it means removing it completely. We have to remove the hazard as soon as possible after knowing that it is dangerous to avoid exposures. Number 2, substitution. It is replacing the agents or work processes that will minimize danger. If there is a hazard in the workplace or a likelihood that a caregiver is in danger, we have to replace or call someone to substitute that worker for that matter. Third is engineering control. It means changing a piece of machinery, for example, using proper machine guards or by placing a barrier between the worker and the hazard, wherein if someone of our machineries or parts of some machineries does not work well, we have to replace them immediately to minimize that danger that will affect the workers or the caregivers. Fourth is administrative control. Administrative control may mean working in a limited number of hours in a hazardous area, as an example. So, we have job rotation. The administrator or the head of the unit has the authority to implement job rotation at work. Why? In order to minimize the exposure of the worker to a hazard. This will also maintain the number of healthy workers that can finish the job or work assigned to them. Last one, we have the personal protective equipment. So, it is a protective wear for caregivers or health workers that includes ear and eye protection, respirators, and apron. This is very important in order to protect the caregivers from too much exposure to a danger or hazard. So those are the 5 major categories of control measures that we need to remember if we want to evaluate and control hazard and risk. After knowing the control measures and evaluating hazard and risk, we have here the practical ways to control hazard and risk. First, we have the use of personal protective equipment or PPE. Let us start with the surgical gown or apron. It is used to protect the wearer from the spread of infection or illness. So if the wearer encounters potentially infectious liquid in solid material, it is used to prevent transferring microorganisms that could harm the vulnerable patients, such as those with weakened immune system. We can wear a gown that is long enough to cover your clothing because the outside of the gown is considered contaminated. This should not be touched when it is removed. Another one, we have the face mask or the mask. It helps to block large particle droplets, sprays, or splatter that may contain germs, viruses, and bacteria. So, keeping it from reaching your mouth and nose. Surgical mask may also help reduce exposure and to limit the spread of respiratory secretions to others. Just like now, we are in the COVID-19 pandemic, still, we need to use or we are required to use face mask even though we are under alert level 1. Are you familiar with the proper use of our face mask? Because I have seen some of people outside or those walking on the streets, they don't know how to use properly the face mask. They just wear it on their faces. The face mask is just from the ear to here, wherein the purpose of using the face mask is to cover our nose and the mouth. But some of them, it is just the mouth, but the nose is open. Letter A. So, the colored side of the surgical mask should face outwards with a metallic strip uppermost. The right way to wear surgical mask is this. So, the colored on the outside and the white on the inside. Next, the colored side or the side with folds facing downwards of the surgical mask should face outwards with the metallic strip uppermost. We need to mold the metallic strip over the nose bridge, and the surgical mask should fit snugly over the face. Avoid touching the surgical mask after wearing it. Why? Otherwise, they should perform hand hygiene before and after touching the surgical mask. So those are the proper way of wearing face mask. This is just a reminder to all of you because it is almost 2 years since the pandemic started that we began to use face mask. Another one, or the gloves. So it is used to protect the wearer and the patient from the spread of infection or illness during the medical procedures or examination. When your hands may touch someone else's body fluids such as blood, respiratory secretions, urine, or feces, certain hazardous drugs, or some potentially contaminated items. So this is for medical use. Do not be confused for those who are using gloves at some restaurants because those are for food use naman. So this one is for medical use. The next practical ways to control hazard and risk, we have the disposal of healthcare waste. Ano-ano ba yung mga healthcare waste? First, we have the human waste products. This waste should be flushed down the toilet without delay and should not be discarded in the street or any public places. So parang mga basura lang natin, we have to dispose properly. Second, we have the blood and bloody fluids. It is important to remember that blood and bloody fluids should be in biohazard bags and not be used for regular trash. So, dapat hiwalay sila ng lalagyan. You can use autoclave bags for biohazard waste only. Do not use the filled bag more than halfway to allow for a 5-inch grip. So, bags must not be stored directly on floors because they may cause spills. Maari silang mabutas. Another healthcare waste that we have are the needles. So these are sharps. If you remember, if you got your COVID-19 vaccine shots, after using the needles, they put it in a disposal container immediately. So, dispose of used sharp disposal containers according to community guidelines. After using the needles, you can put all the needles and other sharps in the disposal container. And lastly, for the medical equipment. If our medical equipment is contaminated, it should be sealed, doubled back, and disposed of based on the existing regulation in the community. Determining which medical devices should be discarded, person responsible must assess each equipment or device current condition and potentially safety risk. So, kung hindi na gumagana ang ating mga medical equipment or exposed na siya or contaminated na, we have to dispose them properly. Remember, the one that will do this are the persons in charge or the persons with too much knowledge with such equipment. For the next practical ways in order to control hazard and risk is the proper hand washing. So proper hand washing or regular hand washing is one of the most effective ways to prevent the spread of germs. Clean hands can stop microorganisms from spreading from one person to another, from your home and workplace into the entire community. We have here 5 steps to wash our hands. First, wet hands and wrist in the running water. Second, lather hands by applying soap, then rub right palm over left and left over right, between your fingers and under your nails. Third, scrub fingers to the opposing fingers and interlock them. Do rotational rubbing of the right thumb by clasping it in the left palm and vice versa for at least 20 seconds. Then, rinse your hands with clean running water and dry hands thoroughly using a clean towel or hand dryer. So this is very easy to remember. Wet, lather, scrub, rinse, and dry. So in order to be familiar with the proper hand washing or the proper techniques on hand washing, I will show you the video of the World Health Organization with regards to proper hand washing. Let's watch this.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
So we are now on our fourth practical ways in order to control hazard and risk. It is to stop ergonomic hazard or stop to ergonomic hazard. So competent control measures are now being utilized by employers to avoid ergonomic hazards among health workers. So manual handling of patients, for example, has become less stressful due to some paraphernalia being used that facilitates the task. Adjustable height workstations and adjusted work pace are now part of the worker's life. Unfortunately, ergonomic hazards effects continue to happen besides those things that has been done. So since we are already aware of what is an ergonomic hazard is, let us consider these simple rules to stop ergonomic hazard. First, avoid twisting the body. Next, bend knees if it is needed. Then, refrain from stretching when reaching for something. Sabi ko nga sa previous session natin, kaya mong abutin ang pangarap mo, pilitin mong abutin ang pangarap mo. Pero, ang mga bagay na hindi kayang abutin ng kamay mo, sobra kang nasasaktan, huwag mong pilit abutin. Kasi that will result to ergonomic hazard. Then, you can use a ladder when necessary if you are reaching something. So the last practical ways on how to control hazard and risk in the workplace is to avoid electrical hazard. How do we avoid electrical hazard? First, as a common sense dictates, you have to ensure that all electrical equipment you used is in good condition. Check electrical cords and make sure that they are not frayed. Your hand should be dry before plugging in any electrical equipment. And do not attempt to change fuses unless you are aware of what you are doing. And lastly, do not turn all appliances at the same time just because you want to save time. This will not help you. Yung panghuli. So, dapat alam natin itong mga tips na ito. Tandaan natin yan. And those are the 5 practical ways on how to control hazard and risk. First, we have the use of personal protective equipment. Second, proper hand washing. Third, proper disposal of healthcare waste. Fourth, we have the stop to ergonomic hazard. Fifth, the tips to avoid electrical hazard. So we have here the protocol in providing assistance during emergencies. So the World Health Organization, together with the International Labor Organization, they established management of occupational safety and health of emergency response workers that should be implemented as an OSH management system. So that is compatible with or integrated into the overall emergency response team, including the stages of preparedness, response, and recovery. When managing the occupational safety and health of emergency healthcare workers, this requires a systematic approach that includes various management functions such as planning, organizing, implementing, monitoring, and evaluating actions in an orderly manner. So those are the practical ways on how to control hazard and risk. As well as we are done with our lesson about evaluating and controlling hazard and risk. Remember the tips to stop ergonomics, to stop electrical hazard. And more importantly, proper hand washing and the proper usage of face mask, together with the disposal of healthcare waste, even the disposal of our waste at home. And that will be all. Thank you everyone for joining me in our learning session today. Huwag kayong magsasawang makinig kay Sel. And once again, I am Teacher John. And always remember that in TLE, matututo ka na, kikita ka pa. Thank you and goodbye.